So welcome to this episode of Menopause Conversations. I'm delighted to have my guest with me today, Dr. Shabnam Zai. Hello, Shabnam. How are you?
Hi, Amanda. I'm really well, thank you. How are you?
Yes, I'm fine, thank you. Thank you for coming on and agreeing. This is a first for me because Shabnam is actually a dentist. And we met at a conference a while ago where we were both speaking, and I was completely captivated by Shabnam's talk, which was all about teeth. The health of these lovely things inside of our mouths that we're probably okay at doing, but probably could be better. And we were talking at that time about some of the things that Shabnam sees when she's dealing with people who come at any stage of menopause. And I thought, I've got to get her on as a guest. So just a little bit of background about Shabnam. She's been a dentist for over 20 years, NHS, and more latterly, she has her own private practice in the beautiful location of Pinner, which is in Middlesex. So welcome, Shabnam. Tell us a little bit about yourself. How did you come into dentistry? Was it something you'd always wanted to do, or did you just fall into dentistry?
No, so interestingly, actually, I never wanted to be a dentist. I wanted to study chemistry and had my heart set on going to Imperial. And I remember having completed my UCAS form, and I was literally, my personal statement, everything was complete. And I was actually posting it, and I was put it in the letterbox, and I pulled it back out again. And I don't know why, I just had this feeling that I wanted to do something sciencey, but with people. And I just kind of took that moment to reevaluate things, and ended up calling my dentist saying I was really confused. And he said, look, why don't you come and see me? And straight away got a bus to his practice. And that afternoon I shadowed him, and I just saw how he looked after his patients. Someone had broken their front teeth, and they came in crying and they left smiling. And I was like, wow, I want to do that. And yeah, I just totally changed paths. So it was a very, very late decision for me. I also, as a child, fell when I was 9 years old, and I broke both my front teeth. So I think seeing that patient who had broken their teeth have it rebuilt reminded me of my time. And I'd already had like a very positive experience at the dentist. I'm quite artistic, so it kind of implemented all my strengths, my artistic side, working with people, and very scientific based.
Wow, what an amazing story. I didn't
I
see
still
that.
have a mug. My mug at work is a periodic table, so I still love
Oh,
chemistry.
do you? You love a little bit of the periodic table. Gosh, don't test me now. My daughter was doing that all last year, all the different groups. How fantastic. What a wonderful story about trusting your gut instinct as well. I absolutely
Yeah, especially that
love that.
age. And I remember people telling me that at that time it was too late. I think now for medicine and dentistry, there's a deadline to apply by, which is in October. But at that time that didn't exist. But it was a kind of unassumed. There was a deadline that you have, if you wanted to do dentistry or medicine, you'd apply by October. This was October. I hadn't done my work experience, and to comply with the UCAS requirements, I had to have done at least 6 weeks. So I didn't actually apply until before Christmas. And everybody told me I was making a mistake. They said, look, it's too late. They're not even going to consider you. Don't even bother. You're wasting your time. And I foolishly or bravely just went with my gut and applied. And yeah, I got 4 offers, and 4 interviews and 4 offers. So, sometimes when it's meant to be, it's just meant to be.
Yes.
And I think they really felt that I wanted to do it. And one advice I'd give to people, with their children going to university, it's very easy to be influenced by what other people tell you what to say in interviews, but really just go with why you want to do it, because it really makes you unique and makes you stand out.
Definitely. I love that story. Well, I think I said to you just before, my daughter's going to university next year, hopefully. And I think they are changing that. They are sort of really encouraging people, do not take your parents' considerations into account. You come, like you said, and you present yourself as you are. And I think that is such an empowering moment for our young people, isn't it? To step across that threshold into adulthood, being confident to speak for themselves, to say it how it is, and not carrying the weight of expectations of either parents, friends, or peer groups or whatever. So I love that. Well, that's the surprise. We didn't cover that last time we met, did we? That is a lovely story, because I'm an executive performance coach as well. So that ties in beautifully with that whole thing of knowing yourself And I suppose it gives us a nice springboard then to sort of think about this time of menopause, when perhaps we're not thinking so much of ourselves. I was talking to another guest this morning on a recording and saying, the reality is we put ourselves so far down the list of priorities, don't we? As women, or people navigating menopause, or even men, so in this midlife stage, we're very busy, aren't we? Maybe you've got children at home, elderly parents, we've got financial pressures. Probably the last thing we're thinking about, Shabnam, in all honesty, is our teeth. So tell us why we should be thinking about that when we think about menopause. I mean, what are the common things that you're seeing so that we can bring it to the attention of people who might be experiencing it and maybe not connecting the dots? A lot of people don't connect the dots between dental health, gum health, and oral health, and actually menopause and what they're going through. So fill in the gaps for us.
Yeah, so one thing I'll say is, as a dentist, I'm quite scientific based, and I like all of my dental protocols and treatment protocols are evidence based. However, when it comes to the menopause, we lack a lot in research. And the reason is because there's so much variation between everybody's symptoms, backgrounds, medical histories. It's very hard to have really good evidence to prove something. Saying that, as I've been a dentist over 20 years, anecdotally over the years, I've seen my patients change. I've seen them from their 20s to their 40s, or 40s to their 60s. And I've kind of been with them through the processes. And I can see how at different times in their life, they have different challenges. And for women, usually in their late 30s to a kind of mid 50s, there's suddenly this increase in symptoms in the mouth that weren't present before. Some of them could be things like dry mouth, burning mouth syndrome, where they have an altered sensation in their mouth. They can get facial pain, which is undiagnosed and often can lead to lots of dental treatment, which is unnecessary. And also sensitivity of gums, recession of gums, generalized crowding, just discomfort in the mouth in general. And there's many different causes to it, and there's many different ways to help people. But sometimes people don't realize that there's actually some really basic, simple, fundamental things you can do to kind of really lower your risks, so you're less prone to disease in the future. And also, sometimes when you do have a complex issue, there's things that you can do to help you get help more quickly. And I was hoping to go through that with you today.
Yeah, brilliant. So can you tell us what is the common link? I mean, because there's so many things there. And I was saying to you before we started recording, I definitely had the whole dry mouth thing. I think that's also because I take an antihistamine every day for a concurrent condition. But recession of gums and burning mouth, I mean, it was just absolutely awful. Do we know, from your perspective, what is happening with our hormones that causes this sort of plethora of symptoms in this area?
Yeah. So definitely hormonal changes. So one thing scientifically proven is pregnancy gingivitis. So when we are pregnant and our hormone levels are changing, our mouth suddenly become much more susceptible to inflammation. So I don't know, many patients notice that when they're pregnant, their gums bleed a lot more, and they brush and their mouth become very sensitive. So definitely there's a link between hormonal changes and gum changes. That is scientifically proven. With burning mouth syndrome, sometimes the causes of many of the things are what we call idiopathic. So there's no known cause. So they can't really quite pinpoint it on one thing. But it definitely is linked to hormonal changes, especially if your estrogen levels lower. And in terms of mainly it's hormones imbalances or fluctuations in hormones which can trigger these symptoms.
And is it one, I mean, because we've got three hormones, haven't we, predominantly exerting their effects throughout our lifetime, but become more erratic in their levels. So estrogen, progesterone, testosterone. Is it predominantly estrogen, or can all of them interplay?
From the evidence that I have, burning mouth syndrome is mainly due to lower estrogen levels, and dry mouth is an overall lowering in progesterone and estrogen.
Okay, so that's really helpful, because often people will say that they also maybe you know, at certain times of stress or whatever, they might be taking hormone replacement therapy, but then some of those symptoms leak through. But as we know, stress can really affect your levels of your own hormones, so you might be getting some of these breakthrough symptoms. So that would make sense. So what causes the recession of the gums then, and the sensitivity of the gums? Is that mechanical or is that hormonal as well?
So it's a bit of both. I don't know if you've heard the saying long in the tooth, which means you
Yes.
get more wise with age. So it's a natural thing that happens with aging anyway. All of our tissues tend to kind of soften, lose volume, recede slightly. So that's something that naturally happens with age. You can have an incorrect brushing technique where you actually scrub the gum away. And unfortunately, once you've damaged the gum never really grows back. So if I have patients that brush too hard, I teach them how to brush more gently but effectively. Electric toothbrushes are fantastic because they have a small head. They tend to have pressure sensors. So if you do put too much pressure, it actually stops working. So you can't really force it. And also you can get what we call sensitive heads. So the bristles are a little bit more gentle, so they're not as abrasive. So there's a mechanical element to it where you can physically brush your gum away. And then there's the aging. And then also, if you don't look after your gums, what happens is they become inflamed, almost like when you twist your ankle and your ankle becomes swollen.
Yeah.
And then when it becomes healthy, the swelling comes down. But when the swelling comes down, you tend to lose a bit of gum every time. So if you imagine it's a repetitive, it swells and comes down, swells, and it just continues to go down and down and down. And in some patients where they haven't really maintained the bacteria level to a safe level, and they've let their mouth be quite contaminated for quite a long time, what happens is the gum actually peels away from the tooth. And when the gum peels away from the tooth, you actually lose the bone support, and the gum follows where the bone is. So with time, the teeth can become loose, you can get bleeding, infections, and eventually you can actually prematurely lose your teeth.
Oh my gosh, well.
Yeah, it's actually the biggest cause of tooth loss in the UK is gum disease. And it's a silent problem because you don't know you have a problem. Most people just feel, oh, you know, when I brush, I get a bit of blood. When I'm eating, a bit of food gets stuck between my teeth. And that's pretty much the only symptom they have, until it gets to a certain level where you've lost so much bone, the teeth actually start moving. And then by the time they realize, it's often already too late. So having regular checkups, knowing whether you're a genetic risk of it, because it is hereditary. It's in my family. So when I was 14, I had some x-rays taken of my teeth, and my dentist said that I had the bone of a 30-year-old. At the time, I was mortified because 30 seemed really old to me.
Yeah. Oh.
But he taught me how to clean my teeth when I was 14, and touch wood, I don't have any gum problems. But even as a dentist, I get my teeth cleaned 3 to 4 times a year, just because I'm into prevention mode. I know I'm susceptible, so I'm going to do everything I can to prevent it.
Yeah, so I had my teeth done on Friday, Shabnam, not specially for this, but I did have it done. And actually, for anyone who hasn't had it done, because I think sometimes people can be quite fearful of that process, can you describe to people what happens when you do have your teeth cleaned?
Yeah, so it's actually, I love getting my teeth cleaned.
I do. I get excited about it, and because it just feels lovely afterwards.
Yeah,
and it's not horrible during either. And I think for a lot of people might have that fear around what's involved during. So could you put people's minds at rest?
I'll be honest, when you haven't had a hygiene for a while, the first hygiene you have can be quite uncomfortable. And it's almost like, I say, if you have sunburn, and it doesn't matter how gently you touch your skin, it hurts. So when you've got very inflamed gums, very inflamed tissues, no matter how gently we try and clean it, unfortunately, it's a bit uncomfortable. When we remove that dirt and we allow that tissue to heal, the second hygiene feels amazing. So usually what we would do is I would ask what you're currently doing in your cleaning regime. Are you brushing? What electric? Is it electric? Is it manual? Are you doing anything between your teeth? One question I always ask is, do you wash your mouth after you brush your teeth? Amantha, can I ask you, do you rinse your mouth?
No, never. Not since I heard you talking.
Yeah. So a lot of people rinse after brushing their teeth because that's just what they've been taught to do, because they want to rinse the dirt away. But actually, I remind people that the reason we use toothpaste is because it has a medicine in it called fluoride, and fluoride is something that I prescribe for patients that are high risk to help strengthen their teeth. So by using fluoride, we lower the risk of cavities by 50%. Okay, and if I was to give you the example of you have a rash on your hand, and your GP prescribes you a cream, and you put this cream on your hand carefully for 2 minutes, would you wash your hand straight away?
No.
And everyone goes, no, obviously not, because I don't want to wash the medicine away. And then I just sit there and wait for them to realize. And they're like, oh, I shouldn't wash my mouth. And I'm like,
no.
So, and it takes a while to get used to that, because I used to rinse as well. And at the beginning, it felt odd. But you have to realize the reason why you're doing it. And once you know what you're doing and why you're doing it, the how, like, it becomes easy. I just don't rinse my mouth now, and I have no fillings. That's amazing.
That's amazing. And
I have, people, and you know, Amanda, I have sugar in my tea. I
know. I was watching you at the table going, hang on a minute.
I'm the one that's loading my tea. Yeah, I know. And the people don't believe me. But what I really believe is that you have to be realistic, that we want to enjoy our life. We should enjoy all types of foods in moderation. We shouldn't be judged for our choices, but we just have to know how to eat it in a smart way. So it's not what you eat, it's how you eat it.
Yes, I love that, which we'll come back to in just a moment. So for people who are just like still trying to get their head around this concept, because they'll be imagining the foam, the white foam, she's actually saying to leave that.
So to brush,
yes, you tell us
to it.
Yes,
spit it, and then don't rinse it.
So is it harmful to be swallowing any of that? Because I know someone would ask me.
Yeah, you're not really swallowing it, because you're spitting the majority of it out. You just got a very slight coating on your teeth, and it's not problematic, not for adults.
No. Now, you described to me what that's actually doing. Now, as a coach, I often know it's important to create motivation for people. So we can ask them to do this thing, and 9 times out of 10 they won't, unless we give them a good motivating reason to. Can you explain to people what's actually happening by leaving that paste on? Because you described to me last time there was something like, is it to do with like a matrix and stuff like that, or is that something else? Yes. So could you describe that?
So the outer surface of your tooth is covered by enamel.
Yes.
And enamel is actually the hardest substance in the human body already. Unfortunately, our diets nowadays are very harsh. In terms of temperature, we have like boiling cups of tea and freezing ice cream. We have like acidic foods and alkaline foods. Our mouth is constantly this turmoil. And the outside part is like a crystal. And if you put fluoride onto your tooth, that fluoride becomes incorporated in that crystal, and it becomes much, much stronger. So you have this outer shell that's much harder. So when you do have a fizzy drink, or when you do eat something sweet, the outer enamel is much stronger, so less likely to get diseased.
Wow. And then so what happens when you're having those fizzy drinks then? So let's say you're not doing Shabnam's top tip of not rinsing, what would be happening?
So in terms of brushing, so you just washing that fluoride away, so you're not leaving it available for your tooth to absorb it. So most people, I don't know anyone that brushes their teeth and has a cup of coffee straight away. By the time you go down, you make your breakfast, you eat it, there's some time, and in that time your tooth continuously absorbs that fluoride.
So here's another interesting one. Do you brush your teeth before you eat your breakfast or after?
Yeah, I get asked this all the time. So I am an incredibly busy person, and I feel that you should just do it when you have time. So the clinical advice is to brush before bed. That is the most important brush, the last thing before you go to sleep.
Okay.
And at one other time, whether that's before breakfast, after breakfast, lunchtime, it shouldn't really matter as long as you're doing it twice a day. The additional thing that I could mention is it depends on what you're eating. So I personally brush when I wake up, just because I just get it out of the way before anyone else takes over the bathroom. Okay. I just clean my teeth in the morning, and then I have breakfast afterwards. And usually after breakfast, by the time I've kind of got ready and everything, another half an hour has passed, and I might just do another quick brush before I go to work. Obviously, I'm a dentist. I see the importance of having a fresh mouth. Yeah. But however, if you're having something acidic, some people brush after breakfast, and that's also okay. However, if you're having something acidic, so if you have like orange juice, or you have apple cider vinegar, or you drink lemon water, or anything acidic, I would advise you not to brush your teeth for about 45 minutes afterwards. The reason for that, Amanda, is that when you drink anything acidic, unfortunately, it always takes a layer of enamel away. Every sip you take, it's like using an eraser. It just takes a layer of enamel away. But the second kind is that matrix I was telling you about. and it's demineralized, but it's still there.
Yeah.
And if you leave that matrix, it can remineralize with your saliva. But if you actually brush your teeth, you actually brush that layer away.
Right.
Sure.
Yeah, so exactly. So what we're saying is really think about the time of day, and if you're having those more acidic things like you say, orange juice or apple cider vinegar. I actually, since I heard you talk, I've bought a straw. I was listening, and
I'm really impressed.
Yeah, really impressed. So I bought a straw because I do drink apple cider vinegar in the morning to help with regulate my insulin levels. So I have that after waking. And I really appreciated you saying that, because that at least has some chance of going down. And like you say, I do wait to brush my teeth, so that's really helpful. So anything else that we haven't mentioned that you tend to see or associate around the sort of time that people might be going through perimenopause, menopause, and post-menopause? So we mustn't forget the post-menopause element of it. Is there anything else that you see more regularly?
So dry mouth is a big thing. So they have difficulty in eating, difficulty in swallowing. Also, when you're talking, sometimes your mouth clicks or you feel it difficult to speak. You can get a change in taste, and you're more prone to cavities if you have a dry mouth, because your saliva acts as a buffer to neutralize acid. So when your saliva flow decreases, your risk of cavities increase. So you haven't changed your brushing technique, you haven't changed your toothbrush or toothpaste, you haven't changed your diet, and suddenly you're getting cavities. And that's because sometimes your saliva flow changes. That could be caused by medicines. It's a common side effect to have what we call it xerostomia, but dry mouth. But it can also be caused by pronounced drops in estrogen and progesterone levels. A lot of the things I'm going to mention also are triggered by anxiety and stress. And when you're in the menopausal phase of your life, sleep is disturbed, you're sometimes not thinking clearly, you're just a little bit overwhelmed. So all these things can actually exacerbate the symptoms. We've already mentioned sensitivity of gums and recessions and teeth. And that is also mainly down to poor home maintenance. So like I was saying, there's really simple things you can do day to day that can prevent a lot of the disease, but people just don't know that. So I'll go over that.
Yes, please.
Burning mouth. So it's you can't see it. It's based completely on symptoms, and it usually affects the tongue, and it just feels like, when you've burnt your mouth and it's just uncomfortable. But when you look at it, there's nothing there. And it can be caused by for no reason whatsoever. You can't find the cause. It could be also caused by deficiencies in iron, in zinc, in vitamin B, some B vitamins. It can be exacerbated by allergies and dry mouth, and anxiety and stress as well. There's another thing that I've seen quite a lot in Asian women, actually, older Asian women. They get this toothache and they get this pain and they can't quite figure out where it is, and it's just, we're never quite sure where it is. We take x-rays, we can't see anything wrong. It could be a bit of sensitivity, could be a cracked tooth, never quite sure. And sometimes it's a neuralgia, and a neuralgia is when a nerve is triggering unusually. I had one patient, a gentleman, and he couldn't shave because every time he touched his cheek, it would trigger this pain. So some people have like a touch point where they touch it and it triggers it. And some people it's triggered by stress or anxiety as well. And it's very hard to diagnose. So if you have anything that has changed in your symptoms, one thing I really recommend doing is keeping a diary. So make a note of what's happening, how long it's lasting for, what did you do just before it happened, what did you eat just before it happened? Because sometimes the burning mouth or the sensitivity of the tongue could be due to allergies. I had a patient recently who suddenly developed an allergy to cinnamon, and whenever she eats cinnamon, she gets a sore mouth, she gets ulcers. Cinnamon, tomato, and chocolate are the biggest causes that I've found so far. And then with facial pain, often what the dentist would have to do if they cannot diagnose the cause of the pain is they refer you to hospital to a maxillofacial surgeon. They call them maxfacs.
Yes.
And they would assess, and they would normally do bloods to check for any deficiencies. They would talk to you about your social history to figure out what's going on in your life, because sometimes, like as I mentioned, stress can trigger it. one of the best medicines for neuralgia is actually an anti-anxiety medicine. So people are like, oh, I'm not depressed, I don't need this medicine, but it's not for depression, it's for the neuralgia, but it actually was very, very effective. And if you have a diary of your symptoms, how long you've had it, all the things you've done, all the things you felt, when you go to that first appointment, they're going to hear you differently. You have evidence of what you're saying to be true. And sometimes you miss that second appointment, you go straight to the third. So they kind of help you quicker because they've already got a lot of the information. When if you just go to the appointment, they'll be like, how long does it happen? How many times in the last 2 weeks has it happened? And on the spot, sometimes you can't remember all that information. And later when the appointment's over, you're like, oh, I didn't have all that information, and you're kind of frustrated with yourself. And you know how long we wait for appointments anyway. So having it written takes the pressure off you remembering, and also it's factual. And you might yourself realize a pattern. It may be that night you didn't sleep so well and the next day the pain was worse, or you may have noticed that that day you ate someone I know also, she's not allergic to raw tomatoes, but she's allergic to cooked tomatoes. So if she has a bolognese or a curry with tomato sauce, she gets a sore mouth, but if she eats this tomato in a salad, she's okay. So she found that out herself, and now she's modified her diet so she no longer has a sore mouth. But that's probably my biggest advice, is to kind of write it down, so you can be heard. It's very easy sometimes. I've had a lot of patients that have been in pain for a very, very long time, been ignored, and that upsets me, because even if I can't see something clinically, I always believe my patients. And it may be stress, and it may be anxiety, and maybe all they need is someone just to hear them. But I feel that everyone should be heard, and it's already a difficult time. So I don't want to ever add to anyone's anxiety or stress. I just want to help them.
Yeah, no, that's absolutely brilliant. I'm just going to lean here to grab my booklet, which I normally have right beside me. But in this booklet, which is free to download, this could be quite helpful for you, Shabnam. But there is actually a diary in here where you can do exactly what you just said, which is to monitor your symptoms. And it's not just symptoms in your mouth, it will be symptoms throughout, so you can actually complete this. And like Shabnam says, you can take it along. I mean, one thing that interests me, because I also have histamine intolerance, if going through perimenopause for 15 years wasn't bad enough, but histamine intolerance. And what I realized is that my drop in progesterone, which is an anti-anxiety hormone, actually triggered a lot of my mouth sensation. So like you were saying, the burning mouth, the dry mouth. So it's really important not to just dismiss some of these things. I can remember I always laugh with my dentist. I always go in, and I went in on Friday, I said, I told you it was something, it wasn't me making it up. And he always laughs, because they did actually get trained on menopause after that, because they said they started to see many more people coming through with this nerve sensation. And what we know about progesterone is progesterone actually is very good at insulating our nerves. So it makes sense, doesn't it, if that's decreasing over time, then maybe our nerves are more sensitive. We're becoming, and
also the connections in the body. So there's been links between gum disease and heart problems with Alzheimer's and Parkinson's. There's so many connective, interrelated diseases that I always tell people, if you keep your mouth healthy, you're going to lower your risk of systemic disease as well, things like diabetes. And it's not just about having teeth. I've got lots of patients that are in their 90s and in their centenary years, and the ones that are mentally still with it, physically able, are the ones that have some natural teeth. So there's something about having natural teeth that works with the brain, it's connected, and it just keeps people a little bit sharper in their later years. And again, this is completely anecdotal, there's no evidence, it's just from what I've seen. So I'm always keen to keep teeth, even if they're like really terrible, I'm like, let's try something, let's keep this thing going. And it's surprising, like I had a patient the other day, he's 70, and he said, I've learned more about cleaning my teeth this last year than he has his entire life. And he was this guy, he's like, I need a hygiene every 2 months. Like, it doesn't matter what I do, no matter what brush I buy, I need a hygiene every 2 months. And I was like, okay. And I taught him how to brush his teeth. And he's like, I need to see you come back in 2 months. I was like, sure. He came back in 2 months, and he sat there and he went, it hasn't come back. And I went, okay. I said, do you want the hygiene? He went, not really. And I was like, okay. And then actually he came back 2 months later and he
Wonderful.
still didn't need a hygiene, because once he'd learned how to effectively look after his mouth, he didn't need me so much. But obviously I still do the cancer screening and we obviously do every screening when we do checkups. So we still need maintenance. But he just has less dentistry now, and his teeth are healthier, and he's going to need less fillings. And then the less often you replace things, the less likely you are to have complex things like root canals and extractions. So you're just saving money, and we're living longer. So we really need to invest in ourselves now. You're right, Amantha, like we really need to make time. And the funniest thing is actually it doesn't take that much. It's often when people neglect things that it ends up being a massive problem. When if they just went like an MOT, if you just get an MOT every year, I tell people to think of their mouth like a classic car. And I said, if you like change the oil, check the tire pressure, that car is going to look beautiful and run for decades. But if you just drive it and the oil runs out and you continue to drive it, you know, the head gasket's going to go, the engine's going to blow, you're going to have no car. So that's kind of a similar analogy with teeth. If you just get it checked, you might need a filling, you might need a clean, but it's very small. When if you do nothing and then you go and you have a problem, it's often not so comfortable for you. And the worst thing is it was avoidable.
Well, this is true. And I do believe that it's what we do before our menopause shows up that tells us how much we've been prioritizing our self-care. And I think comes back to that point. I think people whose teeth are in reasonably good order, it shows that they do value themselves, that they make time to do that. I do totally get that not everyone knows how to do that, because we're not really taught how to do that. The only thing I remember from about my teeth was being at school dropping those disclosing tablets or chewing those disclosing tablets. That's the only thing I remember. I mean, I'm really lucky, I believe. You know, I'm really fastidious about looking after my teeth. I like my teeth. I want to keep them. And they're all my own. Before anyone, I've had so many people say to me, Shabnam, it's so funny, you know, are those your teeth? Have you had veneers? It's like, no, they're mine. In fact, I can prove they are, because this is something I'm quite interested to know. What I've noticed is with my teeth, as I've got older, they're moving in, and I don't mean like massive movement. Can you tell us about that? Because I really got worried. I was like, hang on a minute, I quite like my teeth and the smile.
Amantha, I've got braces at the moment on my bottom teeth. Can you see them?
Wow. Right, so can you tell
I want mine perfect.
Okay.
So it's yeah, you didn't even know I had them, did you? So it's very, very common. So as we get older, our teeth naturally always move forward. And some people thought that it was due to wisdom teeth pushing them forward, but 25% of the population don't have wisdom teeth and they still get this crowding. So it just happens with time. So once you get a slight bit of overlapping, unfortunately, it's only going to get worse. It's called meaty grit. Yeah, no, I'm just being honest. It's going to get worse. So it's better to get braces, straighten them, and then get a retainer. Or if your teeth aren't that crowded, just get a retainer now, and it will just hold the teeth in the position they are currently so they don't get worse. And you just wear that retainer at night, and it just keeps your teeth in that position. Because unfortunately, when the teeth do bunch up and get crowded, they get harder to clean. The gum gets squished between them. You get more food getting stuck. You're more likely to get problems on those teeth as you get older. So
it's just at my front. Not that this is a personal consultation, but it's just at the front there. Just literally. So is it too late?
It's not too late. You can still hold it in that position. That's fine. Because what else happens is that when the bottom teeth start becoming more crowded and one tooth starts coming out, it then pushes the top tooth out, and then the top teeth start getting moving
no,
forward.
I really did notice it, and I was like, oh no, you know. And it's like the classic, isn't it? When you notice something on yourself, it's like amplified. You think everyone can see that at times 40 or times 50.
No, you've got beautiful teeth, but from like a preventative point of view for function and for health, you know, there's no age limit to having braces. People kind of think, oh, I can't have it. I had a patient who's 89 and she's having braces on her bottom teeth. She said, I'm not going to my grave with my money. I want to have nice teeth. And you know, she kept biting her lip because this tooth was slightly forward and it kept catching, and she's got them straight now and she's so happy she did it. And she's like, I wish I did it 20 years ago, you know. So there's no age limit. And
we could do with having a national campaign, couldn't we, for better oral health? I think we could, because
We
I mean, I
could,
think
yeah.
generationally, let's be really honest, it wasn't a focal point. I'm not sure it's even enough of a focal point now, because like you say, if there is that link between, this is where everything sort of enters, really, isn't it, in terms of nutritionally, how we're feeding that gut microbiome, the vaginal
And
microbiome even.
also our emotions. It's how we express ourselves when we
Yeah.
smile, when we talk. Like it's really important. And actually, you don't really know what it's like to lose a tooth until you've lost one. And the loss that people feel is great, especially those that have gum disease, because they don't have any control over the process. And it could be any tooth at any time. It could be this one, it could be that one. They're just like, it's really, they're a really vulnerable position. And yes, you can replace teeth, but it's much better to be healthy in the first place. And you mentioned like putting time aside for yourself. I have young kids, and I'll be honest, for the last 5 years, I hadn't really done that for myself. I'd got my own business, and I just got busy working, and I just like being busy. But what I did recently, which I found really helpful for me, is I imagined myself in 10 years' time and the kind of person that I wanted to be, or even 20 years' time. And I wanted to be someone that had a strong core, that didn't have chronic backache, that was pain-free, someone that really enjoyed traveling, could walk, didn't have any physical limitations. And I didn't really prioritize exercise. In fact, I did nothing apart from walking. I did very little. I drive everywhere. I'm slim, but I wasn't healthy at all. And it made me realize, if I don't do something now, I'm never going to be that person. So now I want to be that person. I've kind of prioritized. Sorry, let me.
So that was real life. Alarms go off, and that's what happens. There's no problem, everybody. There's nothing dangerous. It's a small watch, but it's a lovely reminder that we've all got real lives. So you were saying about, yes, you started to prioritize yourself more.
Well, I just keep thinking of that person I want to be. And then when I'm feeling lazy about not doing something, I make myself, because I go, if I don't do it, then I'm not going to be that person. And I really don't want to be a burden to my children. I want to be physically active in my later years. So I'm a dentist, and unfortunately I've already got back problems. And I've been told by my osteopath that if I don't strengthen my core, that this is going to be an ongoing problem for me. So now I see a PT. So initially I started just by doing 10 minutes of exercise 3 times a week. And if I didn't do exercise, I'd dance with my son for 10 minutes. So we just put the music on and I just dance in the lounge. That's where I started.
Yeah.
And once I did that consistently, I joined a walk. I did a walk with a friend on a Friday morning. Now I do 2 walks a week. Then I got a PT, and now I'm seeing a PT twice a week. And honestly, my life in the last 6 months is like, people can't believe that I'm doing all this exercise.
Yeah.
And I can't believe I'm doing it, because I'd almost made myself believe that I wasn't that kind of person. I'm not the kind of person that goes to the gym. I'm not the kind of person that works out. That's not me. But I realized that I can change that. And the thing that made me feel that I could try was that vision of the person I want to be. And once you know what you want to do and why, the how just kind of happened. Like if you told me 6 months ago you're going to walk twice a week, do exercise 3 times a week, do a PT twice, I'd be like, I don't have time to even have a glass of water in the morning. I'm not going to do that. And it would have seemed too far from where I was. So just make the goal, and then it literally just figures itself out. Don't worry about the how, just worry about the what and the why, and the how will figure itself out.
Exactly. I love that. And it is, so in my performance coaching, we always find those motivations and the things, small incremental changes, but like you're saying, holding that vision of yourself, it's manifesting, isn't it? It comes to you. And I love seeing you on your Instagram, because you're always celebrating, you're out with another friend walking, and it's so lovely to see, because I think it is much easier to give an excuse not to do it than it is to show up.
I found I need accountability as well.
Yes.
I'm not very good at doing things for myself, so I need a PT to get up to go and see. Otherwise, I won't do an hour's exercise. No. I need to meet a friend for the walk, because I won't always do it for myself. So I've realized I need that, so I've just created it. And in terms of like the listeners today, like if I can just give some basic advice on what you need to do just to have a great healthy mouth. I would say it's really the basics. So you brush twice a day for 2 minutes, time yourself. Many people don't. Don't rinse your mouth. Don't rinse your mouth after brushing. Keep that fluoride on your mouth. Drink plenty of water. Water is the best drink for your mouth, especially if you've got dry mouth. Sometimes people suck on sweets and that to increase saliva, but actually that just increases the risk of cavities. And if you're using sugar-free alternatives, unfortunately, I don't think sweeteners are always so good for the body in high doses. If you're having any problems, keep a diary of things. Even a log of when things are going well. You want to see what was a good day like. It doesn't always have to be bad. And I feel that menopause happens and we're going to spend almost half our life in the menopause, so it's something that we shouldn't think was a negative. We should just embrace it. It's a different part. Like we were teenagers and then we were like, I was a mother, and you have different phases in your life. This is another phase and we shouldn't think of it as a negative. We should just think of it as another phase, and adjust and pivot accordingly and support our bodies and our minds as we need with it. Have a checkup. It's a really cool thing. Like I just love doing checkups and showing people come in very, very nervous. I had a patient that hadn't been to the dentist for 44 years.
Wow.
And you can imagine how petrified they were about what I was going to find. But what happened at the end of the appointment was she knew what needed to be done, and within 2 appointments it was going to be complete, and that was it.
Amazing.
And I was like, sorry.
It's okay. It's the watch.
And she and now she has a plan, and she knows in 2 appointments everything is going to be done. So it's totally, now it's manageable because she can quantify it, and it's reasonable, and it's not scary. And yes, she will get it done and it will be over, and she's healthy. So it's not like this ongoing thing. She's going to be unhealthy for the rest of her life. She's done this damage for 44 years. I didn't judge her on any of that. I just said that this is what you come in with. This is what you need. And this is what I can do for you. Would you like it? Yes,
exactly. And it's a bit like going for our smears, isn't it? Actually having someone we can be accountable to, a buddy, a really good friend, someone that holds us to account, says, have you been for your checkup for your teeth? Have you been for your smear? Actually, it's a little harder to go, no, actually I haven't. And actually to talk about how we're scared, but to celebrate. I mean, I, like you, I know this is going to sound weird, I look forward to having my teeth cleaned and getting the thumbs up as much as I do to go and get my hair done, because it's reassuring for me. It's a clean bill of health, and it feels lovely. I can't tell you, when you just run your tongue over your teeth, it's just all lovely.
They feel nice.
So we're recording this on a good day because my teeth look particularly sparkly, and then you get a little polish, which is lovely. But you know what I love going for the conversation. I have a really good laugh with my dentist. We always rib each other, quite sarcastic to each other. But my lovely hygienist, Suzanne, who might watch this because she was asking me about my menopause conversations. So my lovely shout out to Suzanne, who I adore. She's an amazing. She always makes me feel really comfortable. And it shouldn't be something to be scared of, but we can understand totally that if it's not something you've ever done or something you have done, I think the most important thing is to find the people who are right for you. And what I can absolutely say about Shabnam, not only I know you can sense this from her, what a lovely, kind, compassionate person she is. She's very evidence-based. But that compassion bit for me is the most important, I think, because then people feel like they can be vulnerable with you. And she's based in Pinner, on one of the most beautiful locations. You've got water, haven't you, by your practice?
Yeah, so my dental practice is actually based in a historic building in a park. So my practice is actually in a park. For London, that's very, very unusual. And there's a lake opposite with swans and ducks, and it's very beautiful. I feel very lucky.
Not to love. It's absolutely amazing. So we've covered a lot today, Shabnam. So in summary, what we've looked at is, we do know at this time menopause does impact our oral health, as it impacts lots of other systems within the body, and our mouth is connected to those other key organs. You've given us some great advice about things we can do to lower risks, so very much about the fluoride, very much about that brushing twice a day, 2 minutes, you've talked about that dry mouth, the burning mouth, and the toothache, and encouraging people to keep a log of their symptoms is so powerful, because I can remember it would come in fits and starts, and then I wouldn't have a dental appointment, and then I would forget, and then I would lose confidence to think they're going to think I'm making this up. Whereas actually, like you say, if you can take something, you sort of cut your waiting time in half, really, because they're not going to send you away and ask you to do that. And I really liked what you said about having that vision of yourself, because I think we should honor ourselves and value ourselves enough to go, I'm going to look after me. And actually, once you do it and get into a bit of a pattern, you just sort of keep these appointments rolling forward. I know in 6 months' time, because I was on a 4-monther many years ago, but now mine's so good. I actually went 9 months because I had holiday and stuff. I went a gap of 9 months, and she said to me, your teeth look amazing. Because like you said, I've been taught how to use the interdentals. I've been taught how to use dental floss. I know how to brush my teeth properly.
Yeah.
It's great. It really is great.
So one other thing, Amanda, I'd say is that some people get bleeding in their mouth and they think that's normal.
Yeah.
And I kind of say, if you have like blood coming out your eye or blood coming out your ear, that's not normal. So blood coming from your mouth is not normal either. So it's just your body's way of telling you something's not right. So if you've got any bleeding, you just need, that area needs a bit of TLC. And sometimes it's just reversible inflammation, which a hygiene and a learning how to brush can help. And sometimes it's more like serious, it's more gum disease, and that can also be helped, but just needs a little bit more treatment. But just know that bleeding is not normal. And also eat well. People tend to snack a lot now, and they don't need to snack so much. And that kind of frequency of eating really increases the risk of cavities. So sometimes you're not even eating sweet foods. They just like, I had a patient, she didn't really eat any fruit or fizzy drinks or anything. She just had nuts and vegetables. But what she was doing is she was sipping on lemon water all day. And unfortunately, that frequency of sugar just, she needed 21 fillings on her teeth. I had another patient, she was eating nuts and dates because that was her energy thing. But dates, dried fruit, are really sticky. They're high in sugar. I'd much rather have a piece of chocolate than a date, because dates stick in your teeth as well, and it's much harder to remove, and it's much higher sugar content than chocolate as well. I know it's not the same as chocolate.
No.
But you know, you just kind of don't always think that chocolate is a bad thing.
No.
Think about all things with sugars and the frequency in which you eat. I tend to say to have 5 intakes a day, breakfast, lunch and dinner. If you have anything sweet, have it with your meal like a dessert. And then those 2 snacks that you have, they should be something savory. If you drink tea with milk, that counts as a snack. So think about what you're having. I always have my tea and coffee with a meal because I have sugar in it. So I'm trying to lower my risk. So it's not that I don't have the sugar or I don't have the coffee. I have it, but I have it with a meal, and that lowers my risk. So really just think about what you enjoy, what you like, and just think, how can I minimize the risks of what I'm doing? And you've gone over the few things already, just brushing twice a day, getting a checkup, not rinsing your mouth, just really simple. And you don't think it makes a difference, but I promise you that little thing you do every day,
incremental gains.
Incremental gain. I know you read the book Atomic Habits,
yes,
but
I have.
It. Yeah, and
they're cumulative. They're cumulative, and you get like upwards of 30%, you know, increases in benefits and things. And what I would also say is, I would concur with you completely, because we were talking about hormones. If you drink your coffee or anything caffeinated, it will stimulate your cortisol production. So actually, you halve that cortisol production by drinking your coffee with your breakfast, because it's already processing. It's already processing mode. It's not being saved to make cortisol. So I agree with all of those things you've said. So
and one last thing, if I can say,
is a bonus.
Have a blood test, which people don't expect me to say, but I really believe in, like, I don't treat my patients' mouths, I treat them as a person. And know your numbers. So during this time, your body's changing, lots of things are changing. You need to know what your normal is. And sometimes the figures that we're given by doctors are based on historic figures. I know when I had my daughter, they were just panicking me, saying she's on the 9th percentile, she's losing weight. And, you know, but that graph in the red book is based on Caucasian babies from the 1920s. You know, it's not
helpful. It's not
current. No. And it's not Asian. And I was tiny when I was born, and she was just very similar to me, you know. So all that stress was unnecessary. And so you need to know what's normal for you now. So when things do change in the future, you can reflect on it and say, has it changed? Has it not? So then you don't worry or panic. And if something has changed, then you can action it. But I think it's really good for you to know your numbers in terms of your general health.
That is a great line to finish on. So I love that. I really do love that, because I think it is, because again, we have a lot of reduction of the narrative around menopause, in that it just comes down to hormones, and it doesn't. It's a big topic, so let's not keep reducing it. And knowing your numbers is always going to be a great place to start, isn't it, Shabnam? So that's a really powerful point to finish on. If I asked you one last question before I get your details, which is, what would you hope for people going through the menopause transition when it comes to their oral health? What would you hope? Say you look back in a few years' time and think, very proud that we're now here where we are. Where do you want us to be?
I would want people to feel that they can access the care that they need, that what they are feeling is real and they feel heard. I want people not to be scared of the dentist. Like people always say they're scared of the dentist, and if I can just prove one thing, I'm really gentle with my patients. I really care about how I treat them, and it's never as bad. Like, patients always are like, oh, it's not that bad, and sometimes this fear stops us from getting the help that they need. And sometimes the people that need the help the most don't access it. And so if this could have helped anyone just access the help they need and prevent the disease, I'd be really, really happy. And yeah, embrace the journey, because it's the new phase of our life, and it's just enjoy it. Just like, I feel like when I went into motherhood, I changed and I've grown, and I'm a different person now that I've had children. Before I had children, I didn't know what I know now, and I feel that in these later years we're so wise. Like, I feel so happy being 43 now. Like, I'm grateful for all the experience I have. I don't think of all the aging things as a negative. I just think of all the things I've gained on that time. So just kind of embrace the change and think of all the good that's coming with it, and manage anything that isn't so positive in a productive way.
Oh my gosh, can you imagine? You're going to have to take your phone off the hook or put the answer phone on, because I can imagine it's going to go nuts. Because to have someone as lovely as you to be giving that wisdom at a time when people probably do feel so vulnerable is absolutely amazing. So tell us, how can people get more of you, Shabnam? How can they be in touch with you? And how can they sort of take up your services if they want to go that route to actually, utilize your services? How can they do that? So tell us how we can get in touch with you.
Sure. So you can contact me on Instagram. My handle is Dr. Shabnam Zai. So that's SHABNAMZAI. My practice is called West House Dental, and I'm based in Pinner. Another thing I wanted to mention, Amantha, is some people think that it's too expensive, accessing dental care. And for a checkup with me, it's only £50. Like, it's not a huge investment, but the information and the knowledge you get in that appointment is just worth so much more. And yeah, I'd be happy to take any messages. You can even email me, shabnam@westhousedental.com, if you have any questions about your teeth. Or, I know not everybody lives near me, but I'm always happy to kind of guide and help people in any way I can. And I also know dentists across the country. So if you're somewhere and you don't need to find a dentist, let me know, and maybe I can help you find someone that I know and trust.
Yeah, that's amazing. So you're on Instagram. Are you on any other social media platform?
I'm on Facebook as well.
Yes.
And yeah.
Okay, that is amazing. Well, we just know that, people already love you clearly, because they're coming to you and you're creating an environment in which they feel safe. But this is wonderful. We'll put these all on the bottom of the show notes, and I hope people just make contact with you. My goodness, if I lived nearer to you, I would be definitely coming there. And what a beautiful surrounding and lovely welcome. So yes, please be in touch with Shabnam. For now, Shabnam, this has been absolutely brilliant. Thank you so much for giving your time. I know you're incredibly busy, and thank you for being such a positive role model for people who are navigating this time, because it's very easy to think, well, I haven't got the wherewithal to try and do all of that. But what you're saying to us is, start where you're at, start small, start it incrementally, And actually, no need for comparison. I always say this to people: you do you, everyone else is taken, and just keep going. So for now, Shabnam, thank you so much for your time.
Yeah, thank you, Mantha.
Thank you.